Dr. Michael Lange.
All righty, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael P. Lange, P for Paul, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, and a nutritionally related topic. Remember, this is a live call-in show, so no matter how simple or complicated your question is, we will try to answer it to the best of our ability. I say we because Dr. Richard Hall is my co-host this morning, and he is an icon in the sports nutrition industry. Dr. Hall is a nutrition guru who can be seen at the Lange Eye Institute in the Villages, Florida, for free nutritional consultations. That's exactly right, free nutritional consultations. And we're going to get talking to Doc Hall in just a minute. And if you're new to the program, who's Dr. Lange? I'm a board-certified optometric physician, certified nutritional specialist, founded Lange Eye Care and Associates March 15th of 1993, opened the Lange Eye Institute about 20 years ago, and started Fortifeye Vitamins over 20 years ago. You can learn more if you go to my website, drmichaellange.com. It's simply DR, no period after it. So drmichaellange.com. And certainly you can learn more about our supplements that we've developed, the supplements that we talk about that are evidence-based and fully transparent supplements. And what I mean by that, we tell you exactly what is in our supplements. We don't hide anything in a proprietary blend, okay? We tell you exactly what's in it. We have science behind every ingredient, and we show you that science at our website, and that website's fortifeye.com, Fortifeye, fortifeye.com. I'm going to give you two phone numbers. Get a pen, a piece of paper, a pencil. I'm going to give you the phone number for the Lange Eye Institute in the Villages, Florida. If you want to set up an appointment to see me, Dr. Hall, Dr. Somerton, Dr. Caputi, any of us, and I'm going to give you the phone number for Fortifeye Vitamins. The phone number for the Lange Eye Institute in the Villages is 352-753-4014. That's 352-753-4014. And then the toll-free number for Fortifeye Vitamins is 866-503-9746. That's 866-503-9746. And this is Black Friday, 2023 week. We are starting today. Listen up here, folks. Starting today, 35% off all Fortifeye Vitamins except Super Omega. But Super Omega 3 Max is 35% off, folks. That brings it down dramatically. So go to fortifeye.com, and at checkout, there's a place that you put in Black Friday 23. All right. Remember, Black Friday 23 is the code that will give you 35% off. Folks, our Fortifeye Organic Blue Green Superfood is probably less than $20 with this 35% off. Also, on Monday, you can go to the Lange Eye Institute. Everything's 35% off on Fortifeye only. And today, the Fortifeye Nutrition Center in Clearwater, which, by the way, I'll be there for an hour from 11 to 12 today. If we got a big crowd, I'll stay later. Today from 11 to 12, 35% off all Fortifeye except Super Omega, but Super Omega Max will be 35% off. And then the Lange Nutrition Center in Ocala on Monday, Tuesday, and Wednesday. Go see Mandy or Mary. And remember, 35% off Black Friday special. All of you have been waiting for the fall festival that we usually do. We aren't having a fall festival this year. So we're giving you 5 days on the internet for 35% off. Black Friday 23 is the code, Black Friday 23. Anyway, Dr. Hall is probably biting at the bit to say good morning and hello to everybody. Doc, how the heck are you this morning, my friend?
Good morning, everyone. Thanks for tuning in. We're glad that you're with us. And good morning to you, my best friend and colleague, Dr. Lange. Glad to be with you again this morning on this pre-Thanksgiving show. Can't believe it. Thanksgiving just around the corner, just in a few days. So I know everybody's out and around this morning, probably getting that last minute or their first run of the food, and to get it all in and doing a little extra shopping. So we hope that you're tuned in with us, and if not, you'll catch us up on the podcast later. But anyway, did a little hike this morning with my group, and since today is, and this is true, is National Hiking Day, I literally veered off the path. And we did a little hike through the woods. It was different and fun, to say the least. Everybody was laughing and had a good time, and I realized that it was a good exercise in balance as well, going through the woods. And so it was a great way to start the day and something a little different. And just a reminder, I need your help. Okay. I need your help in filling the Toys for Tots box at the Lange Eye Institute. We just have 2 weeks left to fill the box because the toys will be picked up, of course, early on December 7th, so they can be distributed out and given to the kids. And help me put some smiles on some children's faces come Christmas morning. And don't forget to stop by the Salvation Army kettle for a quick donation. Even if it's coins in your pocket, every little bit helps. And those are 2 places that I always have to hit every holiday, and makes me feel good to do that. And you know what? You're doing some good at the same time. So if you're in the area of the Lange Eye Institute, stop in and drop off a toy. Folks, it doesn't have to be a computer. It doesn't have to be a bicycle. It doesn't have to be any of that. You can go to one of the local dollar stores and pick up a couple of dollar toys. Believe me, a child would rather have a dollar toy than none at all on Christmas morning. So help me out with that if you would, please. I've got some Thanksgiving tips I want to give you this morning, and we'll do that in a little bit because I know we're getting the lines loaded up here. And also have a little segment on inflammation and what we can do about that, and a couple of product bundles that we have that are really doing some good out there, and I need to pass that along to you. So stay tuned for that, and back to you, Dr. Lang.
All right, we're going to talk a little bit about glaucoma in a minute. Phone lines are open, 1-877-969-8600, 1-877-969-8600. Give us a call one more time, 1-877-969-8600. So natural glaucoma treatment. Cardiovascular exercise is very important. B complex, omega-3, vitamin C, saffron, something called Mirtogenol, and a new one called Neumentix. And that encases our new Fortifeye eye pressure and neurocognitive support. Brand new supplement we've been working on for many years. It's going to be a supplement backed by multiple clinical studies, all right? Mirtogenol is a combination of bilberry and pine bark extract, and we've been using it for years successfully for patients with elevated pressure for glaucoma suspects, in addition with glaucoma drops to help bring the pressure down even more. And the studies are pretty doggone good, showing that Mirtogenol by itself can bring the pressure down consistently and considerably over a period of time. Now, it doesn't work as fast as glaucoma medications. It doesn't take 2 to 3 weeks. It can take a couple of months, but it does work at bringing the pressure down. But here's the kicker. Oftentimes, we put people on a prostaglandin analog or another glaucoma medication, and the pressure isn't where we want it. Well, now you have something that you can potentially add, Mirtogenol, a natural way of bringing the pressure down. And folks, the studies are pretty amazing, showing that it works as effectively, if not better, than many of the additional drugs at lowering intraocular pressure. And we've seen it in our practice many times. So Mirtogenol is going to be in the new Fortifeye eye pressure and neurocognitive support supplement. But Neumentix is the new one. The Neumentix, we were the first in the United States. This is made by Kimon Foods, or actually Kimon Industries. They're the ones that make the lutein and the zeaxanthin that are in our macular degeneration formula. They're an amazing company. So Neumentix is a plant-derived neurotropic, and it's a derivative of spearmint, okay? And it's been shown in clinical studies. Now, these are animal studies currently, but to aid in neuroprotection, to help stop or to enhance the health of the ganglion cells, to stop ganglion cell dropout and death in elevated pressure models. Also to help preserve the nerve fiber layer. These are amazing studies. Also, it's been shown, and they're using in Europe right now, to help with working memory, attention, and cognitive abilities, and improves circulation to the eye as well. So all of this. So when I was doing all the research, I said, what the heck? Let's combine the two, the Mirtogenol with the Neumentix, and we're calling it Fortifeye Eye Pressure and Neurocognitive Support. It'll be out, I'm hoping, in 2 to 3 to 4 weeks, and we'll have it available online. We'll have it available in the Lange Eye Institute as well. And I'm sure many doctors are going to start utilizing it. Now, remember, this does not replace your glaucoma treatment. This is not a treatment, all right? This is not a cure for glaucoma. This is a nutritional support for the optic nerve and brain. And we're posting all the studies on the website to show you proof is in the pudding. All right, we're getting ready to go to the first call. One more time, the phone lines are open. 1-877-969-8600. That's 1-877-969-8600. I also mentioned vitamin B complex, especially niacinamide, B12, B6, can help support the optic nerve also in glaucoma patients. Omega-3, vitamin C, and saffron. So I'm thinking a bundle for glaucoma would be where we bundle our Fortifeye Complete or our Fortifeye Macular Defense with our omega-3 and the new Fortifeye Eye Pressure Neurocognitive Support. Well, I'm losing my voice. Let's go to the phones. I think Angelica in Dunedin has been waiting patiently. Good morning. Welcome to the program.
Good morning. Nice to meet you over the phone.
Yeah, you too.
I listen to you every Saturday, and finally I'm able to call you guys. I have my father's side of the family has a lot of arthritis, and my grandfather had colorectal cancer, and so I was wondering. As of right now, as of the past 6 years, I'm 25 years old right now. My husband got me onto vitamins about 6 years ago, and I've been taking my vitamin B complex. I found out I have MTHFR, and I try to stay off of gluten. I try to stay away from dairy as much as I can, and I'm starting to do kind of like a juice fast, unintentional.
Mm-hmm.
But I was wondering your input on, besides the standard vitamins, B complex, C, magnesium, vitamin D3, K2, methylfolate, what do you say could, keep that at bay, colorectal cancer and arthritis?
Well, I think obviously, trying to eat as many things organically grown as possible. All right. Sometimes that's very expensive. Obviously, no smoking. Stay away from things that have dyes in them and have carrageenan, basically things that are preserved, canned foods, frozen foods, bottled stuff. Try to eat as natural as possible. Shop around the perimeter of the store where everything is as natural as possible. Like I said, preferably all organic. And I don't think dairy is as bad as you think. There's a book, though, called The Devil in the Milk, okay? And if you read that, most dairy you're not going to want to consider, because most dairy has a genetically modified casein protein called beta A1 casein. And that's been affiliated with leaky gut, cancer, diabetes, and even autism. And so, but the same thing doesn't apply to all dairy. So goat milk, sheep milk, sheep cheese, goat cheese, and A2 cows have a non-genetic mutation. They have an A2 beta casein that isn't affiliated with that. So I think if you stay with A2 beta casein or stay with sheep or goat or an A2 cow, you're probably going to be fine. Now, also by the same token, a lot of people say, well, stay away from gluten. I agree with that. I don't love gluten. All right. Gluten can cause inflammatory conditions and things of this nature. Same thing, carrageenan. Look at labels, because carrageenan is one of the leading causes of irritable bowel, and it's in everything. It's in ice cream. It's in chocolate milk. It's in just about everything out there. But as a rule of thumb, try to drink plenty of fluids and drink good water, spring water preferably, or Wata water, not the water coming out the faucet. Remember, depending on where you live, the faucet water has chlorine and fluoride. Both of those in high dosages can be carcinogenic, all right? And then get to your ideal body weight. If you're 5 pounds overweight, that's okay, but 25 pounds overweight is not. So get to your ideal body weight, a little cardiovascular exercise, a little sunshine, living in Florida. Believe it or not, if your vitamin D levels are elevated, you're less likely to get many types of cancers. But if you're out in the sun too much, you're getting sunburn, obviously it can increase your risk of different types of skin cancers and potentially melanoma. So there's a fine line, not too much sun, but you definitely have to have some sun. And as far as vitamins go, I think, if you're eating a well-balanced diet and you're eating tons of organically grown fruits and vegetables, do you really even need to take a supplement is the question. I think a supplement is a good insurance policy, all right, because most of us aren't going to shoot for 13 servings of organically grown fruits and vegetables on a daily basis. And so a good multivitamin, the problem is most multivitamins you buy out there are not that good. They barely put anything in it that has a therapeutic level, and who knows where it's coming from. Like I said, I started the show off talking about transparency. We make one called Fortifeye, Next Gen Fortifeye Complete, and it has the methylated form of B12 and folic acid. It has no beta carotene in it because remember, beta carotene blocks the absorption of the carotenoids in the xanthophyll family, specifically lutein, zeaxanthin, and astaxanthin, that are very beneficial for every cell in your body. So, not just trying to promote Fortifeye Next Gen Complete, but that's something we've developed, and you can go to the website at fortifeye.com and look at that nutrient profile. If you don't want to take Fortifeye, you can actually purchase something that's similar to that. And remember, that multivitamin is kind of like an insurance policy. But shoot for 13 servings of organically grown fruits and vegetables a day. If you fall short, then you're at 10, so you're doing very well. And if you can't get that much, our organic blue-green superfood is all certified organic. It's gluten-free, and it's FODMAP-free. That means it doesn't have any of the fruits and vegetables that cause inflammation in the bowels and the gut and in the intestines, which would be beneficial for you. I know I threw a lot at you all at once, but I'm going to let you chime in now.
Yeah, I was actually going to ask about the carrageenan. What is the deal with carrageenan and guar gum and being in everything now?
Yeah, so
usually
I'm not overly concerned about the guar gum as much as carrageenan. All right, carrageenan is a vegetable-based something that makes things a little creamier. It makes things flow better. They use it in veggie gel caps, but carrageenan is one of the leading causes of IBS. It comes from a special type of red algae, so I think it might be good, but it causes inflammation in the gut lining. And so at one time we had Fortifeye Focus, and we had a veggie gel cap made from our Fortifeye Focus, and we had quite a few people that started having upset stomachs on that. So when I went to fish gelatin, all of their symptoms went away and had no problem. So if it has carrageenan in it, I would definitely stay away from it.
Nice. Thank you. Yeah, we eat literally like nothing prepackaged. Produce, well, the prepackaged would be the meats, I guess. So I know they're vaccinating the cows now. So
and the pigs.
That's another factor to consider.
It's tough. I mean, in reality, we really should, raise all of our protein from babies, and we should raise our fruits and vegetables, but, that's not realistic. And you got to trust somebody, who knows if they're not just sticking an organic sticker on the vegetables in the back of the supermarket. You never know, right? You got to put your faith and trust in somebody, and you got to take the bull by the horns, though, and practice the things that we discuss. Try to eat as good as possible. Remember, ideal body weight. You're young, and so the most of our people out there that are, 50, 60, 70, 80, they can actually change their lifestyles now and add up to 13 years to their life by changing the lifestyle. But if you adjust your lifestyle now, heck, you'll live to 115, 120.
Yeah, exactly, like the Essenes.
There you go.
All right. Well, thank you so much.
All right, Angelica, you take care.
You too.
Bye-bye. And
Bye-bye.
Doc Hall, this is one thing Doc Hall is all about, and once again, free nutritional consultation. So at the Lange Eye Institute, I'll see a patient. Here's an example, a diabetic, 100 pounds overweight, diabetic retinopathy, bleeding in the retina, suspicious for glaucoma, all right? Elevated triglycerides, blood sugar out of control, blood pressure out of control, not a compliant patient. When I tell them, look, you're going to go blind before you die, all right? If you don't adjust your lifestyle and do something now, it really stimulates them to be motivated. If you tell them you're going to have a stroke or heart attack for some reason, they don't get motivated. But you tell them they're going to go blind, they get motivated. And then I walk them out to meet Dr. Hall. He sets an appointment, and they come back to see Dr. Hall. He goes over everything with a fine-tooth comb. We've had patients that have lost 200 pounds from me and Dr. Hall's consulting. Doc Hall, that's what it's all about, isn't it? Helping people as naturally as possible. We're not taking them off their medications. That's up to their doctor, but we give them the power that God really wants them to have.
Well, what I'm seeing though, Dr. Lange, and it's a little bit disturbing because, we're, like you said, we're all about the help. We want to help folks get on the right path. And many, many people that I see during the course of the week, they think that they're on the right path. They want to be on the right path, but they've taken the wrong path to begin with. And it's my job to get them back on the right path and get them gone down the road. I see so many people that they think, well, where I'm doing this or I'm doing that, or people that will say, well, I eat a very, very good food, and so I don't need vitamins. And then you talk to them a little bit, and they're not doing quite as well as what they thought. And what your advice to the young lady earlier was very good advice as far as the multivitamin. I always tell people a good multivitamin, like our Complete and like our Mac Defense, it covers all the bases. And so then, you don't have to worry so much. I mean, and now that doesn't mean that you're not supposed to eat good foods. And you can go off the organic path. That doesn't give you the license to do that. But what it does do is it covers all the basic paths in our basic needs, really, I should say, in your body. And that's how you start the day. I start my day every day with one of our Complete vitamins, and I also do our superfoods. That's my drink in the morning. That's what gets me to Ocala, to the Villages, to see my first patient, is that drink in the morning. So that's all good advice, and sounds like she's on a really a good solid path. She knows where she wants to be, and she's working her way there. But anytime that you want, you can come see me at the Villages. And it's a free consultation. Dr. Lange and I do that, and it's worked out fantastic.
And and she also talked about the family history of arthritis as well as the colorectal cancer. And so now is the time for her, and hopefully Angelica's still listening, to be proactive, because an anti-inflammatory diet, something like the Lange Survival Diet. Folks, I took a combination of the paleo diet, the keto diet, the plant paradox, the Mediterranean diet. I combined them all into what I call the Lange Survival Diet. And we took out all the lectins, the phytic acid, the oxalates, the protease inhibitors, the alkaloids, all the things the gluten that cause inflammation in our body, inflammation in our gut. But there's still plenty of fiber in there, all right? And this is a problem because a lot of people out there are on these crazy diets where they're just eating protein. They're eating cheese and bacon and steak and fish and chicken and turkey, but they're not eating anything else, and they want their body to go into ketosis, and they test their urine to make sure they're, excreting these ketones. And a lot of these people are not, it's like the old Atkins diet too. They're not having any fiber in their diet. You need fiber that cleans out the intestinal linings, helps reduce the chance of the dreaded colorectal cancer. That's where fruits and vegetables come in. I think 75% of that should be vegetables, and then 25% fruits, just specific fruits. And we have that listed on the Lange Survival Diet. But Doc, aren't you seeing that also, that people aren't putting much fiber in their diet anymore?
Absolutely. I see more people that have bowel problems, digestive problems, and like that. And when they tell me that, I have people say, Dr. Hall, is it normal that, I don't go to the bathroom, but every, fourth, fifth, sixth day? Well, no, it's not normal. That, was it always like that in your life? Why now is it normal? And I'll look at them and I'll say, I'll bet you're on a special diet, right? And I'll go, gee, Dr. Hall, you're really good. Yes, I am on a special diet. Well, that diet doesn't contain any fiber. And we need fiber, folks, in the body. I mean, that's, instead of going and paying, $19.95 for a jar of fiber that you sprinkle over, or you take by the spoonful, or a oil capsule or something like that, eat some fiber. And most people are not getting that. And fiber is one of the easiest things to get in your diet. It really is. And, if you have questions about things like that, you can call me or make an appointment, come see me, and I'll get you on the right path with it.
Yep. Go ahead.
Dr. Lang, what I was going to say too is since we're talking about inflammatories and things like that, I just wanted to give you a real quick little thing here. Then we'll get to the next caller. Both you and I see dozens of patients each week who complain about muscle and joint pain. And they rely on pain relievers to get them through the day without knowing their body is inflamed. They just don't realize that. It's just, that goes with the age or the territory or whatever. My old bones are getting achy. The meds, they mask the pain and do nothing or very little, to say the least, to what I want to say, alleviate the problem. It just doesn't do that. So our approach is to attack the inflammation in a natural way. Dr. Lang, as you know, you and I developed a product, two product bundles, in fact, named Omega Relief and Omega Relief Extreme. Omega Relief Extreme consists of our original omega-3 and our curcumin formula. And those are all anti-inflammatories, folks. Let's get the inflammation out of the body. The total cost of that package there is $52. Our oh my goodness, our Omega Relief Extreme contains the two anti-inflammatory products I just mentioned, plus a third anti-inflammatory, black currant seed, or known as GLA. And the total cost of that $77. So what we do, folks, is we attack the inflammation from the inside out, okay? And we get tremendous results. Like curcumin, I've seen people with pain, with arthritis pain. I had a lady come to me the other day, and the older lady, and she says, you know what, Dr. Hall, I can't get rid of these. And she held her hands out, and her hands were disfigured and from arthritis over the years and like that. She says, but you know what? I don't have the pain anymore. She says, I can live with this. She says, but the pain was just too much. And she says, I got on the right program. And she says, my pain now, out of a 1 to 10, she says, might be a 1 or 2 on certain days. Other days, I don't even think about it. So we try to attack the inflammation from that way rather than just mask it over, which does nothing.
That's absolutely correct. And I agree. The Fortifeye Omega Relief Extreme and the Fortifeye Omega Relief are a natural way to help support the body to lower inflammation naturally. Remember, it doesn't replace your rheumatologist or the medications that you're on. Many of you that have autoimmune diseases are taking, prednisone, gold injections, your naproxen, you're on methotrexate. There's a lot of different medications that you're taking that, quite frankly, are doing, good for you. And so these never replace those medications. But we do see many patients, when they adjust their lifestyle, get on the proper diet, lose weight, get on supplements like the Omega Relief Extreme, when they see their rheumatologist, their internal medicine doctor, they're able to get them off of many medications. And everybody knows I'm a big advocate of the least amount of medication, the least amount of surgery that gets the job done. And that's what sets us apart at the Lange Eye Institute. You come see us. We're not only board-certified optometric physicians, we're all certified nutritional specialists as well. And we do actually more continuing education in the nutritional arena than we do in the eye care arena, because we sponsor a lot of these nutritional shows. So we sit through all of the continuing education. I mean, we get hundreds of hours a year in continuing education combined in eye care and nutrition. All right, phone lines are open, 1-877-969-8600. That's 1-877-969-8600. Remember, folks, this is kind of like our fall festival. We're doing 35% off all of Fortifeye vitamins except Super Omega. We're doing Super Omega Max. That's our newer one, and that's 35% off of that. But it's 35% off everything else, the superfood, the proteins, the macular defense, the complete, the GLA, all of that. Now, it's not 35% off the bundles, because the bundles are already jacked way down, probably even more than that. So always look at the bundles. But if you buy the vitamins individually, you can buy as many as you want. Take advantage of that 35% off. We're never going lower than 35% off. Folks, this is more like 50% off, because we did not raise our prices this year at all. And our prices went up significantly. So if we raised our prices, maybe we'd give you 50% off, but 35% off is as much as we can do. Take advantage of that. Remember the code is Black Friday 23. Write that down. Black Friday 23. Also, I see a lot of you are texting and emailing and on Instagram and on Twitter and LinkedIn and Facebook right now, messaging me. I can see you messaging me, but I can't see those messages because literally it's 10 feet from me right now. So please go back after the show. When I post these Instagrams and Facebooks, go back after the show and ask the question again, because for some reason, all the questions when I post the Instagram video from the day, they all get wiped out. So go back and ask me the question after I post today's video. All right, we're getting ready to go to the phones. 1-877-969-8600. 1-877-969-8600. Before we go to the next caller, I just want to harp a little bit more on this transparency bit with Fortifeye vitamins. And I'm just using Fortifeye our organic blue-green superfood as an example. There's a lot of companies out there that are just taking, 6,000 milligrams of a blend, and they call it a proprietary blend, and they put 100 different nutrients in it. Well, folks, you don't know what's in it, all right? You don't know if it's dust. You don't know if it's 99% of one thing and then, 0.1% of the good stuff. So if they don't tell you what's in it, it seems like they might be hiding something, and that's my opinion. Also, many fruits and vegetables don't go well together, and we think of this when we put together a superfood. An example, apples, pears, and bananas block the absorption of blueberries, blackberries, strawberries, bilberries, and raspberries. So those should not be together. And I see lots of superfoods have them all together. Carrots and sweet potatoes block the absorption of green peppers, orange and yellow bell peppers, and other things. And then spinach and beets and almonds increase your risk of kidney stones. So they should substitute kale for spinach in these superfoods. Remember, we think of all this when we develop something, and that's what our Fortifeye Organic Blue-Green Superfood is. So check it out at fortifeye.com. Remember, it's 35% off if you're going to use Black Friday 23 as the code. All right, let's go to the phones. Joe in Venice. Joe, thanks for holding. Good morning.
Good morning. How are you?
All right. And yourself?
Wonderful. I got a question. I went and got my work done, my blood work, and the doctor told me my thyroid number was high. And she tested me about 6 or 8 weeks later, and it was still kind of high. And then she prescribed some medication, and I thought it was a quick fix to get the numbers down. But I guess the way they explained it was going to be a forever drug. Is there anything I can do to get that number down, or what causes that number to go high?
Yeah, so they said hyperthyroid, not hypothyroid, right?
Yes.
Yeah, so that has to be treated, and usually an endocrinologist, an internal medicine doctor also is good at that. They have to look at the blood numbers on there, your blood chemistries, and you have to get that to an effective level, because it can cause a whole host of problems, from being tired, and a lot of ocular problems can be involved with thyroid problems. Your eyes can get dry, considerably dry. You can get proptosis. That's bilateral exophthalmos, where the eyes start to bulge. That's kind of like Graves' ophthalmopathy, and that can cause exposure keratopathy to your corneas. And a lot of other problems can cause that are even more serious than that. So it's crucial to get those thyroid numbers under control. Now, there's a lot of doctors that will use a more functional, holistic approach if they think you're going to do it. There's some natural ways of actually helping hyperthyroid, but it depends on what your numbers are. If they're way off the scale, they're going to want to medically treat that and get it down to a more acceptable level. I got some good information that's hard to go over on the phone, Joe. If you want to shoot me an email, I'll give you my personal email address, and I will give you some doctors in the area that are a little bit more holistic at this, and also give you some information that talks about, some things they can do more naturally to help. It's not going to replace what your doctor's doing, but there's also nothing wrong with second opinions. So write my email down. It's iDude92. So that's EYEDUDE 92 at iCloud.com. And that's the letter iCloud.com. So iDude92 at iCloud.com. And shoot me an email and say, I'm Joe in Venice. I had the thyroid question. Give me that information.
All right. I appreciate your time today. Thank you.
All right, Joe. Take care.
Bye.
All right, phone lines are open. 1-877-969-8600. That's 1-877-969-8600. Give us a call. And so I see a guy that I can read because he put it all in bold print. Current bodybuilder. My protein go-to is blueberries, strawberries, bananas, all blended together with your super whey protein. Is this a bad thing? Question mark, question mark. Well, you know, Doc Hall, before a few months ago, we would have said that was probably a pretty good thing, wouldn't we?
Absolutely. And that's pretty much the standard, you know, when it comes to protein smoothies and like that. That's kind of the ingredients everybody throws in there.
Right. And now I say it's not a good thing because we found out in a recent study that fruits that you cut and then leave out and they turn brown or black very quickly, that's bananas, apples, pears, they can actually block the absorption of flavonoids that are in berries. So berries are very potent antioxidants. So ex-bodybuilder or current bodybuilder, I can't even see your name, but I see the bold print there. Yeah, just you can still do the banana. Don't put the berries in it, or do the berries without the banana. You can still eat bananas and berries, just not at the same time. All right. There's a special enzyme, polyphenol oxidase, that blocks it, but we're not going to get into the science. So you can make a blueberry berry smoothie, that's fine, or a banana smoothie. Just don't put the two together. We're getting ready to take another call. 1-877-969-8600. 1-877-969-8600. Remember, this is the Black Friday 23 special. So when you buy any Fortifeye vitamins at fortifeye.com, put Black Friday 23 at checkout. There's a special code section at checkout, right? You won't see the discount until you go to checkout. Put Black Friday 23 in, and you're going to get 35% off. All right, let's go to the phones. Steve in Clearwater, good morning. What's up?
Yeah, have you ever seen any studies where with omega or some of the fat soluble vitamins as to people who have their gallbladder removed and if they would eat like like an egg with their vitamins, it would counteract that lack of gallbladder?
Yeah, so most people need to be taking enzymes when their gallbladder has been removed because they have trouble, as you know, metabolizing fats. And usually the doctor that removes the gallbladder is going to put them on an enzyme. And, you know, we have Fortifeye enzymes that helps break down lipids, fats, carbohydrates, proteins. And I take it as a rule of thumb, you know, anybody over 40 or 50 should probably take some enzymes before their cooked meals. All right. And for those of you that had your gallbladder out, obviously talk to your physician about it. But I definitely recommend taking enzymes before any fatty foods. Okay. Also, just eating some raw fruits and vegetables, especially fruits, that can help break down the foods as well, the proteins. Believe it or not, apple cider vinegar can also help break down. Pineapple can help break down proteins because the enzymes, the bromelain and the acids.
Very interesting. Yeah, I've often wondered if, you know, that if it would be interesting to do a study to see if people who have their gallbladder removed get other diseases after that, you know, like autoimmune diseases and stuff like that.
That's a great question.
I don't know if they've ever studied post gallbladder pathologies. It would be interesting to see if any. I'll look that up and see if there's anything like that.
I want to keep my gallbladder. I don't want it removed. I want all my organs intact.
Why do most people lose it? Is it because they get stones or what's the reason?
Gallbladder attack really hurts and they're in pain and they have to remove it. These things get inflamed and they're very painful. And then the question is, why does that happen? You know, is it their diet? Is it their lifestyle? Is it genetically predisposed? I'm not an expert in that arena. I'm sure there's a doctor out there biting the bit that wants to call in and tell us, but yeah, pain, just like kidney stones. Remember, I'm kind of an expert in kidney stones right now because I vowed to never get a kidney stone again after my first one. And kidney stones are painful too.
Well, that's one thing that patients and doctors sometimes. They ask you what's your pain between 1 and 10. That's more based on your personality and than on any objective. In fact, I had a friend that told a doctor one time. He said, when it comes to the evaluation of pain, you physicians have an unsurpassed capacity for underestimation. Okay, I'll let you go. Have
Bye,
a great
Steve.
day.
Take care. All right, we got a few more people on hold. We're going to take the call in just a second. 1-877-969-8600. 1-877-969-8600. Remember, you can come to the Lange Eye Institute for all of your eye care needs. We also have the largest optical in the area, and we have very economical frames, and we have the ultimate in designer frames. And we have the entire line and exclusive in the area on Cartier, also Gucci, LaFont. I mean, so we've got some really exclusive lines. So if you want to spend a lot of money on a cool frame and be a little bit different, we've got them at the Lange Eye Institute. Or you want a $99 special, we have that as well at the Lange Eye Institute. We've been very busy. I have to tell you, we're getting ready to expand the Lange Eye Institute, add a few more exam lanes in. We just put all new flooring in there. So we're constantly always trying to expand and make things better for our patients. The phone number for the Lange Eye Institute, and I'll be there this Monday. Dr. Caputi will be there this Monday. Dr. Hall will be there this Monday doing free nutritional consults. Call us at 352-753-4014. That's 352-753-4014. Also, a lot of you are wondering when the Fortifeye Rejuvenate is coming out. Well, we finally got clearance and legal signed off on our label claims and all of that. So we're in manufacturing as we speak. Remember, Fortifeye Rejuvenate is going to be a combination of the newest marine collagen tripeptide, hyaluronic acid, rice ceramides, and a superfood combination called Dermaval, plus pure whey vitamin C, vitamin A, vitamin D, vitamin E, and zinc, all combined in 3 amazing flavors and an unflavored one. So it's going to help to minimize fine lines and wrinkles in the face and the entire body, increase hydration and elasticity in the skin, and help our joints. One of the reasons I developed it is for me. I'm kind of greedy. I want to reduce the pain in my joints from all of my accidents I had racing motocross. All right, let's go to the phones. Robert, thanks for holding. How's it going in Largo?
I'm wondering why you take your probiotics in the evening, and also why intermittent fasting is not favorable.
Okay, so I think probiotics, and it depends on the probiotic. As a rule of thumb, I tell people to take probiotics on an empty stomach. Now, a lot of these probiotics are now enteric coated and they're acid stable. So the reason I did that years ago, remember, if you take them with food, the body secretes more hydrochloric acid and it starts to break down the probiotics and denatures them, and you don't get the full benefits. So a lot of doctors will recommend you take it at bedtime, and hopefully you're not eating a big meal right before bedtime. Or you can take them first thing in the morning as long as you're not eating for an hour or two. So it's all due to the acid content in your stomach. Intermittent fasting. I don't think intermittent fasting is bad, Robert. I mean, we intermittent fast every night when we go to sleep, okay? Because we're fasting for 8-9 hours. But a lot of people overdo it, okay? And a lot of people, and I see it all the time. I even had a physician in my office the other day, a cardiologist. She was white as a ghost, and she was looks like she's getting ready to pass out. And she said she didn't feel good. And I said, when's the last time you ate? And she said, well, I'm on an intermittent fast to try to do a cleanse. And I went in the other room and got her a Snickers bar. I said, eat this right now. And she says, no, Dr. Lange, I'm trying to lose weight. I said, eat the Snickers bar. And she ate it. And I said, I'll be back in about 4 minutes. In 4 minutes, she was smiling. Her face, the color was back. I mean, she had no carbohydrates. She was hypoglycemic. She's getting ready to pass out because her blood sugar was probably 25. So intermittent fasting can be very dangerous if you prolong it for too long a period of time, okay?
And that's probably why all of a sudden I feel weak and I feel like collapsing and my body begins to vibrate.
Yes. I would not do intermittent fasting. I would eat carbohydrates. Just don't overdo it. As a rule of thumb, if you eat 5 small meals a day, all right, small meals, that have balanced, you got your fats, your carbs, and your protein. So have some vegetables, have a little fruit, and have some protein. You don't have to be overdoing it with pasta and bread and stuff like that because they're carbs and fruits, okay? Then you're going to feel better and your metabolism is going to stay constant. So try that and I bet you feel better, okay? When you feel like you're getting ready to pass out and you're starting to shake and you're thinking, oh, it's all for this intermittent fasting, this is a good thing. No, wrong. It's not a good thing.
Is that what I mean by vibrating? The body begins to shake?
Yes, and absolutely. And your cognitive abilities become impaired, all right? Like if my blood sugar was, 40 right now, I wouldn't be able to talk on this talk show. I'd be a babbling idiot. So I'm going to let Doc Hall chime in on this because this is one of our pet peeves. We see people all the time on these crazy diets and they come in and they think that, oh my God, I'm supposed to be detoxifying and I'm on this low carb diet and I feel terrible. I feel really dizzy right now, Dr. Hall. And we give them something to eat and they feel great. Doc Hall, isn't that one of our pet peeves?
Absolutely. And, you made a good point there too, about we fast every single night. That's creator's way of saying, your body needs a timeout. It allows your machine to rest, okay? And your machine being the body. All right. Now, I had a lady in the other day. She was lightheaded. She said she was worried about dementia and Alzheimer's because she was getting brain fog at different times during the day. And so the more I checked into everything, she was doing intermittent fasting. All right. Her first meal of the day was not till noon. All right. Her last meal of the day was at 4 o'clock. So she was fasting every day for 20 hours. All right. And for what reason? Dr. Lange, you've said it thousands of times over our radio show over the years that, God made a pretty good body. We just have to take care of it. And sometimes, we get overboard with that. And, well, we need to clean out our body. We need to cleanse. We need to do this. And okay, I agree with that once in a while. But, if you have a decent diet, decent supplements and some exercise program, that's not as important. It doesn't seem to be. Now, if you're a junk food junkie and, you're drinking alcohol and snack foods and junk all the time, well, then that's a different problem. But, pretty much we fast every day. So for the last caller, you're risking something there that I don't want you to do. And that's, when you're getting lightheaded and brain fog and dizzy and your body's shaking, well, you know what? Your body's telling you something. This is not the right path for you. And so let's go the other way and let's fortify the body. Let's strengthen the body. Let's not tear it down because really when you're fasting, that's what you're doing. You're tearing down the body. And it's in a positive way, but it's still tearing down the body.
Right. And I think fasting, if you're supervised by a medical professional, then, and they're trying to do fasting for a particular reason. Obviously, if you're under medical supervision, it's okay. But there's too many people out there willy-nilly just not eating anything, and they think it's good for them and trying to lose weight. And a lot of these people are driving the car and passing out and getting in car accidents and possibly hurting others and themselves just because of the lack of food that they're eating. Okay, Robert?
Thank you. The salivary glands continue to work on carbohydrate in the stomach?
Well, your salivary glands start to release amylase. That's an enzyme that starts to break down foods immediately. Okay, so that's crucial. Now, here's a little hint. Do not use mouthwash, all right? Especially before you're going to eat. I just stay away from mouthwash, period. Because mouthwash can denature these enzymes that are responsible for breaking down the foods and that's responsible for releasing nitric oxide, which is vasodilators. And so they've been studies. They did this with dentists. And if they used mouthwash twice a day, their blood pressure went up because they weren't getting the dietary nitrate conversions for the vasodilation of the blood vessels, and their blood pressure went up. So I'm not a big fan of mouthwash. Now, I'm not a big fan of bad breath either. All right, the music's on, Robert. We got to roll, buddy. We have 10 seconds. Doc Hall, tell everybody goodbye.
Be kind to yourself. Be kind to others. Happy Thanksgiving, everyone. We'll see you soon.
All right, I'm out of here. God bless you and God bless America. See ya.